everyone. This is Esmée St James. I'm founder and CEO of the Dating Muse. I'm on a mission to make smart single men irresistible. And if you're a guy and you're single, that means you. I'm here to interview Dr. Rich Castellano. He is one of the best plastic surgeons in the country. Dr. Rich is founder and CEO. I know you are. I see you all the time on Periscope. Dr. Rich Castellano, founder and CEO of ImageLift. And he has this, is it patented or I don't even know, this process for facelifts that makes them really quick and easy, and it is not like a traditional facelift. So Rich, say a bit more about yourself, because I could go on for hours, but...
Thank you. You're so kind for the introduction, Esmée. And it's an honor to be on this interview with you. So I'm a board-certified facial plastic and reconstructive surgeon. I have 2 board certifications. We do a lot of cosmetic treatments for the face, facelifts under local anesthesia. I'm the #1 facial plastic surgeon injector of Dateable in the United States. We're very proud of that, and we recently won an award at the Aesthetic Show for the best cosmetic facial enhancement, non-surgical with fillers. And the ImageLift is a process to help people look younger in today's visual society, and I've discovered that nothing that I can do ever looks as good as Mother Nature's free facelift. So I'm just here to help people look and feel their best. There's many ways to do that, and I want to do, just for my people who are watching on Facebook Live, we did a brief intro before. This is Esmée St James. She is the dating muse for smart, serious men and helps people find connections, find the relationships of their lives by first creating a better relationship with themselves. So Esmée, amazing to be here. Thank you so much. I know you had some questions about cosmetic procedures for men, so I'll let you take it from here, and thank you again for having me on.
Oh gosh, it's my extreme pleasure, Rich. May I call you Rich, or do you want me to call you Dr. Rich?
Fine.
I'm going to call you Rich because that's what I normally call you.
I'll call you Ed.
You may. Yes, you don't have to call me Miss St. James. So today, our subject is plastic surgery for men. Will it get you more dates? So I work with men that are, I know, kind of makes you wonder, doesn't it? Because lots of women get it. And I have found that lots of men get it too. But the thing is to get it done so that it doesn't show. Most of the men I work with are over 40. And around that time, they're either divorced or been in a long relationship and they're out of it, or perhaps they're widowed, or if they've been working their focuses off all their lives, and now they realize, oh my God, I want to have a family. I want to meet the love of my life. And they don't have the tools for that. And as well, often they'll want a woman who's a little bit younger than them. And that's totally fine, because if you're around 40 and you want to have some kids, yeah, you're better off to find somebody who's a little bit younger and, better with her body to do that, to bear children. But in order to do that, you are competing with all those younger guys out there, right? Or if you're, around in your 50s or so, then you might still want younger women. And also business-wise, you're competing with younger guys again. So I sometimes recommend to my clients to get a little something done, like Botox or a mini facelift or something. Rich, tell me, do you get a lot of male clients? Because some guys go, oh my God, are you kidding? That's for women. I would never do that.
No, we absolutely get men that come through. I mean, it's more women than men, because women are certainly very visual about their appearance and they express themselves through their appearance. And men are certainly more physical and they may not care as much. And then there's a societal double standard. Men don't wear makeup and they don't, but men are doing this more now. And there are men, even masculine men, that want to wear makeup. And now that there's gender fluidity, so people are even changing what men and women mean. So all that being said, when men come to me and they want cosmetic treatments, it may be simple things like if they've just got sagging skin and they really just want to look younger. If you want to look younger, sure, you can take some of the creases and the wrinkles, or we lose the volume, and then you can do some fillers, and it doesn't have to be overdone. So everybody knows you got to get your teeth cleaned a couple times a year. We take care of our teeth. There was a time when that wasn't really a thing, many, many years ago. Well, now it's what? Of course you have to do that. Now people come, they get their hair done really nicely, or especially if they are dating. I've had people tell me, well, yeah, I'm already married, but if something were to happen, if I need a new relationship, I would come and get that done. So yes, little nips and tucks, and that helps. The biggest reason that helps is just to build their own confidence.
Thank you. Yes.
It's not going to make as much of a difference. The biggest difference, I believe, in the relationship is going to be how much masculine energy or how much feminine energy they put out, depending on if they want a masculine or a feminine partner. Because the stronger that masculine energy they put out, the feminine energy is going to respond, and vice versa.
Yeah.
So I feel, do the plastic surgery if it's good for you. I had a buddy recently, he had his ears tucked in, even mine stuck out a little bit, but I want people to notice me, so check my ears. So, but we tuck them back, and, if they're really sticking out, then some people get very self-conscious. Yes. And my buddy did that, and he felt really confident about it after the fact, and he was in a long-term relationship, and it was just for him. So I think to build your own confidence, if it's something that's on your mind, if it's in your heart, go for it. I think that's cool. Make sure you get a great doctor. That's the most important decision you'll make. But for the relationship part of it, I think it's not going to play as much of a role. I think, you said, hey, there's all these young men on the market. Well, fine. But if they don't act like, if they don't put out a strong masculine energy, or you don't have that strong feminine energy, that's where you're going to hurt your chances of getting dated, vice versa.
Exactly.
They're strong and sure. And that I can help people look younger, but if you want to look attractive, there's only one way to do that.
I bet I know what the answer is. Do tell.
I don't make the rules up. If I see someone coming in, and even with, of course it is the smile, but even like the Uber model, where they'll model and be like this, it's almost like I'm a fashion god.
Oh, so oh God. My dad used to talk about that. Why are they all like this?
Is that what they call it? Blue steel? Is that what he calls it? That comedian? That. Oh,
yeah.
Ben Stiller. So I mean, it's really so simple. It's about being sweet. But I can certainly remember when I was a teenager and I wanted to, date girls, and I felt, and it's tough to be in that spot. And confidence. Yeah. Masculinity.
Yes.
Their behaviors, and appearances matter for a lot of different things, but appearances are more important based on behaviors.
Yes.
Behavior will make your appearance look so different. You can do so many different things that make your appearance different just by behavior.
Yes. Oh my God. Yes. Wake up there.
That's right. Change your behavior.
Yes.
Cosmetic procedure, yes, it can help some things. And it's all relative. If you want to look young and you hang out around older people, you'll look younger. That certainly helps. But the smile, I'm going to be a broken record on that one. Smile, it always helps. So I'm trying to find a place where smiling hurts you. Maybe don't smile while you're in front of the judge.
The only way it smiles is when I smile too much. My face starts to hurt, like right about now.
So you feel the burn.
Yeah. Ooh.
So plastic surgery, I think, can be done well, but it can feminize the face, and some people want that. So men look good with a low, flat brow like this, low. But the moment you raise the brow too much in a man, it does not look masculine anymore. It's like, hey, how you doing? But it's feminine. A feminine brow is raised up like that. So Botox for men, you got to be careful when you put it in the crow's feet, because if you arch a man's brow, he does not look masculine.
I have seen that. Not pretty on a guy.
Yeah. If you're a man getting Botox, do not arch the brow. Even I did do a little bit here. Like I can still move my brow, but I do a little. I was getting pretty soft, deep creases. So just a little touch. A little touch
is perfect.
Expressiveness. So, I went without for a while, but no, it's an occupational hazard. I'm 84 years old. I've just done a lot of cosmetic treatments.
You look mighty fine, my friend. And so aside from, and I love that tip about the Botox, because I did not know that. I mean, I got a little bit now, and I don't have much really, but he always does this raise the eyebrows just a touch.
Good. And I think light dosing, because you can tell if someone has no movement in their brow at all.
They're like that.
Flat, too flat. But you want a little bit. You can do some and look alive. So I try and maintain some of that. Again, it's an art form. It's who you go to. So find someone who's good. Yeah. And don't skimp when you do your cosmetic procedures. Fillers, if you've got hollows, or we can get really hollow under the cheeks.
Yes.
Areas out, then that's it looks good. I love to do those things, and it's simple to do the fillers. There's no downtime.
Yeah, because isn't it true that as we age, the fat in our face starts to migrate downwards, and that's why women and men also get jowls?
Well, we lose the fat. The fat
Oh,
atrophies the bone. I mean, we get a little bit shorter.
yeah.
You get bone loss. Your skin will thin. So
Hmm.
I call it three categories. We sag,
Hmm.
we lose volume, and we get sun damage to the skin. If we're lucky, aging keeps coming. So sag, sun damage to the skin, wrinkles, and sunspots. So those are the areas we treat. But younger patients, they'll start with the fillers. You just replace the volume. There's no surgery for that. You just do some plumping.
Hmm.
Temporary fillers or permanent fillers. Okay, that's where we set ourselves apart.
Hmm.
Matter of fact, I'm going to brag a little bit. So this was our award that we won.
Ooh.
And for the best cosmetic rejuvenation of the face using facial fillers. And so fillers are great, but go slowly. It's better to come back another day and do more rather than go too far. Some people say, well, what if I do it and it just looks all funny and goofy? If you go slow enough, that won't happen, and you choose the right artist. A lot of people know how to do it. That doesn't mean that they're an expert at it.
It's true. It's like when you go to get your hair done, when I go to get my hair colored or cut or whatever, I could go down the street for $10 and get a cut, but is it going to look good? Oh, I don't think so. No, it's the same thing. You can buy shoes that's, cost you $20 and they're plastic and they kill your feet. They might look all right, but you're going to hate them and you're never going to wear them. You're not going to be happy.
Yeah, don't scrimp. So I'm a believer in cosmetic procedures for people who are into dating relationships.
Yeah.
However, the first thing they need to get a facelift. Everybody needs a facelift, the free one. Get your free facelift.
Yeah, I was going to say, wait a minute.
You know what's interesting? I do smiling pictures with my patients. So we'll take 12 pictures total. I take them with and without flash because the darkness and the shadows show up more with no flash.
Yeah.
So we take them frontal, oblique, and then the lateral. So there's 5 total with and without flash, and then one smiling with and without flash. And interestingly, the before and after pictures, when they smile, you'll see some differences, but the smile washes away a lot of what I do. Now, it does help them look young. When you're at rest, you can definitely see the difference. But you really should not engage other people. It's almost like we engage people in the lowest energy mode that we can. Okay, I'm here. Yeah, okay, that's fine. Then, but if we're like, it's Esmée. Oh my gosh. And, good to see you. How are you doing, honey? Oh, yeah, great. Oh, great to see you. And you put all this energy. That was way more fun.
It
than
makes
just
such a difference.
on our cell phones. Like when your cell phone battery gets really low, it says I'm putting you in low energy mode.
Yeah.
So that way it doesn't wear your battery out too much.
Mm-hmm.
So live on low energy mode. What is up with that?
I don't know, but when a guy comes up to me and is just like all the same wavelength, it's like, dude, are you alive? Like, can I poke you and see if you're alive? It's like, spice it up a little, like, hey, can you hear me?
You heard that joke about the 2 80-year-old people went on a date, and then when the woman came back and talked to her family, they asked her, how was the date? She said, I had to slap him 3 times. She was like, what, was he getting fresh? I thought he was going to sleep. I thought he was dead. So, yes, we need to slap ourselves.
Sometimes we do, yeah. And so I'm curious. I'm dying to ask you, Rich, what is the most effective procedure where a man can get the most bang for his buck? And that's one question. What's the most effective procedure that is rejuvenating? And number 2, what are the ones that make a guy look more masculine?
Well, it depends on what their age is.
Let's
Younger
say 40 plus.
When they're in their 40s, fillers do a great job to make them look younger.
Okay.
It's not what they're trying to achieve. Guys today, they're being, they are manicuring their eyebrows, but if they get too thin, they lose their masculinity. So you gotta be careful with that. And whether it's some they want a lot, or you just have to decide how au naturel you want to look. But whatever you manicure here, so fillers and Botox are easy way to start. And it looks nice to have good skin. And me, I'm as pale as a ghost. I'm white, so I don't get a tan or anything.
You have beautiful skin.
Thank you. I eat a lot of vegetables. And so skincare is always good. Sunscreen, sun protection. This is just not good at all.
And it stinks.
It's bad. And so they do have a new patch out that helps you quit smoking, and it works 100% of the time. Have you ever heard of it?
No.
Have you heard of this? Yeah, you put it right on the filters.
I knew there was going to be something there.
So don't smoke.
It's
And
like,
fillers are an easy way to start because there's no surgery, there's no downtime.
yeah.
And most people will benefit some. If we're after 2025, we will lose volume. So if you want to retain that youthful look or you want to be preventative for future aging, the fillers can do a good job with that. Once you get into your 50s and 60s, we all start to get a little something going down here.
Yep.
So then if they want to tighten that up, if that's important to them, yeah, we have laser tightening. There's radio frequency thermage. There's another one called Thermitight and another one Vivace. I was just talking to my good friend and colleague Farhan Tahizadeh, and he's got this Vivace unit, which is amazing. We'll demo it out in our office. And he uses needles and energy that delivers deep to the tissues, no downtime. You may have a little bit of a premium for that, and it's a subtle result.
Mm-hmm.
Or if they just want their overall best result, a lift is the gold standard, but some people aren't ready for that psychologically.
Surgical if you have this stuff going on?
Well, there's Kybella that you can inject to get rid of the fatty tissue.
What dissolves it?
Laser. Yep, it'll dissolve it, but it doesn't do anything with the sagging skin.
Okay.
There's laser that tightens the skin because we lose the elasticity. Laser, radio frequency energy, and ultrasound energy. Those are tightening.
Oh.
Cool sculpting, and there's the fat
sculpting here. I didn't know that.
It does help, yep. And then the facelifting is kind of the gold standard. So when someone's just ready for that and they want the best, that's where I come in.
Okay. So you don't do that. You do the fillers and the Botox too, though, don't you, Rich?
I do all of them. As a matter of fact, I've got my little book right here. This is our facelifting book that we guarantee we can make you look younger. Oh. And it hit the Wall Street Journal bestseller list. We're very proud of that. It's on Amazon. Patients will read this. It's on Amazon.com. Patients will read this and they will say it's very informative. And there's a lot of before and after pictures.
Oh, I love that stuff.
Stories. So it's a really simple read. You can download it, the ebook, or download the physical book from us. So that's a resource that we use to help people learn about what their options are.
Awesome.
And that's the spectrum that I recommend. And I will give smile homework to everyone. Let's see. We got a hello for tuning in. Sandra Watts, teeth doctors in Rochester, New York, with Glencliffe. And when are you in New York? Hello. They asked a question. I'm not sure if you're saying, are there teeth doctors in Rochester, New York, or Glencliffe? I'm sure there are. And when am I in New York? I don't know when our next New York. We need to figure something out to go to New York, Esmée, and help some people out there.
Let's do it. So tell me about your smile therapy. I'd love to hear about that.
So the smile therapy and smile homework. So when you have a smile score, your smile score is kind of like your weight. People don't want to come out and say, I weigh 142 pounds. Or they don't want to, it's like, you're 100 and this pounds, or you're this. Like, it's like, ooh, don't say how much I weigh. It's a little personal. And it's the same with the smile score. So you never want to call anybody's baby ugly. You don't want to give them a lower smile score than what they think, because then they're like, So you just have to let them guess what their smile score is. But you can do 0 to 10. Some people smile all the time. Some people never smile. Call them a top third smiler, a middle third smiler, or a low third smiler. Mm-hmm. Most people will categorize themselves correctly. They'll say, oh, I don't smile that much. They'll say, well, I'm kind of middle of the road. And I get some people that say, oh, yeah, I'm a high smiler. Now, if they're high smilers, then we just play and we have fun and we are silly and we just laugh about anything. Oh, it's so much fun. And then if they're middle of the road, the high smilers and the middle of the road smilers, I challenge both of them. Well, I challenge all of them. Can you dig a little bit deeper and smile even more? So first is awareness. Mm-hmm. We can't improve anything if we're not even aware. Because some people will say, gosh, do I smile a lot or a little bit? They just know. In their mind, they say, I know how to smile. Am I in the category of I don't know how to smile? No, that's not me. I do know how to smile. But they're completely unaware if they smile a lot or a little. And one of the questions I like to ask people, where do you feel you get your smile from? Now, I ask this question very carefully because when I ask that, they're like, what do you mean I get it from? Do I get it from cereal? I get it from ice cream? What are you talking about? I give them a few choices. So just narrow it down. I say, do you get it from your parents' good smiler, or your family? Because maybe they lost their parents. Were your family good smilers? Or maybe you went through a hardship in life and now you realize how good you have it. And they'll, kind of give them those two choices to see which ones they'll take. And it can be emotional. Some people will get upset about those things. So I try and dance around it, or I'll try and be playful if they start getting a little upset.
Yeah.
But people will either tell me, they'll give me one parent, they'll say, oh, my mom was a great smiler. And then my response is, oh, that's so sweet. Or my dad was a great smiler. Oh, or they'll say, oh, my parents, they never smile. And they'll say, oh, I just have always smiled. I don't know where I got it from. Or they'll say, I went through a tough time and I just realized how good I have it. I've got a friend, they lost their sister. They took their sister's child in. Believe me, when you lose a sibling and you're raising their child, you don't let the little details just bug you. You're not just crabby about anything. You're like, you went through heck and back.
Yeah.
So, but you get people to think that they learned their smile. It's like their language. Smiling is a language. Yeah. So when they realize they got it from someone, then it starts them to think, even how we laugh. You ever notice how families can laugh the same?
Yes.
Like there's a pitch to the laugh.
Yep.
There's a cadence to the laugh. Yep. We may laugh when we go, but even the people, like I like to go, but some people will be silent with the method of their laugh, or they'll yell. They'll go, ah!
That's my dad. I do that sometimes. I scare people. I can't help it. It's like, ah! And I slap my leg.
But the rhythm of our laugh, when you let people go, and it's beautiful to hear people's laugh rhythm.
Yes.
We learn that from people, and we mimic others closely. You laugh, and then you go, ah. It's like the after laugh.
Yes. It's like the post-orgasm sigh or something,
That's one way of putting it. And so, it's a language. Yeah. It shares so much information, because when we are looking at people, are they a threat or not? It's hard to be a threat when someone's laughing.
Yeah.
I'll kill you. I'll beat you. We know they're not going to hurt us.
Yeah.
Like this.
Yeah.
We don't think they're like this, like they're a serial killer, and be like, hey, don't worry, you're in good hands. I'll take great care of you.
It's me, Rich.
It is scary, because I was communicating to you way more than the words that I was saying. So it's powerful. It's powerful. Our world would be a fascinating world if we couldn't say anything at all. Like if we're going to do no words, then I'm just going to.
Do you know, I have done some of that. I've gone to some silent retreats. You don't even mouth anything really, but is this thing working?
You went to a silent retreat? What was that like?
Well, it was a self-help kind of self-development event I went to, and there was a 24-hour period where we were not permitted to speak. Now, I had a roommate, and we constantly would talk, right? So it was hard as heck to not talk, but we did it. We made it through. Even yeah, kind of, yeah. She stubbed her toe really, really hard. Like I think she broke it, and she didn't make a peep. Like she was a tough cookie. So it was like, oh my God. But what happens when you stop verbalizing, everything else comes through. We all felt extremely emotional, because when you don't have your words as a barrier between you and the other person and any kind of a sound, you can't help but let your inner self come forth and flourish and wrap other people with it. And you become also very vulnerable, because it's like your weapons have been taken away from you. And I find that wonderful. It's yes. Yeah. And so, so you start having to use your body language and your facial expressions and your smile.
It's powerful. With my kids, when I'm disciplining my kids, I will sometimes tell them, no more talking. That's enough. Hello, Holly. Thanks for tuning in. And, because that's their argument tool. Like they're upset. But what about this? But what about that? I'm like, there's no more words.
Yep.
No more. But they're stuck.
Yeah.
And my patients, sometimes when I do the lift and we do that, and are you doing okay? They're like, I can't hear you that well. Or their ears there's some swelling. And I say, don't worry. Most of what people say is not worth listening to. And I mean, that's a little bit mean, but it's kind of true. I like listening to people, but I really I don't listen to the words so much as what they say.
Oh,
Because it
gosh,
takes
yes.
too long to think. Hello, hey Holly. Oh, thank you. You're so kind. Thank you, Holly. I'm proud of you too. You're amazing. And Holly's a good friend. They opened up a real estate practice for
Oh,
their
wonderful.
kids. So much fun.
Yeah.
Thank you very much for joining. So yeah, I mean, I simplify my life. It takes a lot of concentration to focus on like every word people say. And I like listening,
Yeah.
but more importantly, I'm reading them. They're like, oh, positive, positive. I'm like, oh, you're positive. I love positive. And then I'm just giving that positive energy. But if they're negative, then I was like, oh, and I'm like trying to figure out how to lift that up. And then I just like to focus on that energy. It's like the stock market ticker.
Yep.
That would be so cool if we could have a smile market ticker, like say, hey, good to see you. And it's like this, and then I'm listening. And if I'm just not I'm getting disengaged, I'll go down again and I'll go, oh, like this. Or we say something like stub my toe, like your friend did, and like, it goes down really low. That would be really cool. But that's how I live my life. Everybody does have that. You just have to learn how to look for it and see it.
You know what I call that, Rich? I call it the unspoken conversation, because no matter what words are coming out, I don't hear half the words that someone's like cluck, cluck, cluck. It's like whatever. My mind is going with the unspoken conversation, the body language, the facial expression, the energy level, where they're looking with their eyes, are they engaging? You can feel what they're feeling and yet not let it be part of you. And that is what I listen to. And some people will suck you dry because they're energy vampires and they're not energy givers, or at least not even. And so it's the vampires that, whoops, my thing fell out, that I'm staying away from, that I stay away from. And yeah, I won't work with them. I will not work with them. Yeah.
We become who we spend time with.
Yeah.
And the smile score is predictive of your relationships.
Yes.
If you meet a high smiler, that is going to be more fun, a relationship, more creativity, it'll last longer. And if you have a low smile score, you'd mentioned that one of your clients, they can never get a second date. I'm just going to tell you, they are a 2 smiler, maybe a 3 at most.
Yes.
And that's their challenge. So I got this right here. I'm going to pull it right over. Here we go. So that's why I've got a 5-step process.
You mean this book here?
Oh yeah, there you go. Oh, I got to take a screen capture of that.
But mine is personally autographed. Wait, where did it go? I had Dr. Rich autograph mine. Is that cool, or is that cool, huh? Thank you, Rich. I love it.
So I'm telling you, I really think that when they are focused on that, and more importantly, focused on the people around them, what makes people around them smile, that is going to be the most powerful thing. But oh my gosh, we've been talking. It's like we could talk forever. This time goes on.
Okay, I'm going to tell you about a client of mine. I don't know if this is a cosmetic or plastic thing or anything, but yeah, it could be. He's a lovely man. Again, very bright. There's so many smart men around here that are lovely men that would make a wonderful husband or boyfriend for those women that complain that there's no one around. And when I coached him, it was last year, I think, I said, you know what, here, do some practice, because he would get very shy and would falter around women that he found really hot, whereas with anybody else, he could talk their ear off, no problem. I said, just to catch their eye and smile. You might say hello. They'll think you're crazy. Who cares? And keep on walking. Just do that. Do 5 women a day, or whatever you can manage. And he said, well, I don't smile. I don't like my smile. And I said, give it a shot. Let me try. And his whole face lit up when he did. It was a little wonky and stuff, but it was cute.
Yeah, you got to own your smile. When you're out there, you're like, I don't give a damn what people think about me. I'll smile when I want to smile.
And that shows confidence. And
people watch. When you're people watching, and if we catch someone's eye attention, what do we do if we're people watching and they look at us?
Smile, because they caught you.
But a lot of people, they'll turn away. They're like, oh, I wasn't looking. We turn away. But if I keep a little baseline smile, because it's just there, like you don't want to be trying not necessarily to connect with someone other than to give them a smile. If I'm just a little smile, and if they look my way, I'm like, hey, I'm just looking your way.
It's an acknowledgement of another human being that you just were looking at and admiring for whatever reason. It's an acknowledgement. Hey, you exist, I exist, we're all one. It's great. Why not?
I'm curious, when you're working with your clients, if you rate them on their smile score, get them to say their own smile score. Get them to say it, because if you give it to them, if you give it to them, then they sometimes may take that personally.
Yeah.
But give them to rate their own smile score and just accept it with it, because the number doesn't matter. The only thing that matters is you just do it more.
Yes.
So make them rate themselves and just see if they can bump it up a little bit.
Exactly.
And I tell people about that. It's really funny because I'll talk to them. I'll say, "Oh, and I'll put a little bit of a smile." They get into it. They start laughing, and I'm like, "I did not say laugh. I said smile more. You're messing with this whole thing." And they're really laughing, and it's like, "Hello, Michael Loy and Dr. Somiatis. Thank you for coming in." So what else we need to talk about for your clients, because I got to wrap things up. And
I know you got your beautiful wife to go home to. So, okay, Rich, what about, do you do eyelid surgery? Because you get some guys and women too. They this, I don't have it yet, I guess, but the pouches here, they start to fall over the lashes, and they look tired. They get bags under the eyes, even though they get sleep and they're healthy. What do you do about that? And do you recommend it?
yes, I'll show you. Actually, I've got some pictures here. So the eyelids is really high set. I'll pull up these little photos for you. So these are in my young patients. Like he's a friend of mine, and you can see here. Now this, you see, let's see if the light's so bright. Can you see his eyes there?
Oh my God, that makes a huge difference. I love it.
So that's, and then there's, and then even in young women, and you can see how the eyelids.
Man,
right? And
what a difference.
So those, you just freshen a little bit of eyelid skin. Now, traditional eyelid procedures, they'll take skin, muscle, and fat for everyone. I just take the skin only. The more cosmetic, you don't want to prematurely hollow out the area.
Yeah.
You preserve volume, and it's less of a surgery, less risk when you just stay more superficial. So when I'm doing it and I do the numbing medicine, it plumps the area up with the local lidocaine, local anesthesia, what we call it. And when they do that, and I'm broadcasting, like, it's hard for them to open their eyes, but once I do one side, I ask them to open their eyes, and everyone on the live broadcast is like, "Oh my gosh, they open their eyes!" And so that's a simple procedure to do.
Yeah. Okay, good. So just to recap then, Esmée St James here, founder and CEO of the Dating Muse. I'm a dating and style strategist for men on a mission to make you irresistible. And I'm here with Dr. Rich Castellano, fabulous plastic surgeon for both men and women, founder of ImageLift, the wonderful procedure for a quick facelift. And we were just talking about what works for men. Is plastic surgery appropriate for men? And yes, you've come to the conclusion that of course it is, if you want to look as good as you feel. And
building the confidence. Doing it for yourself is the right reason.
Yes.
If you're doing it to impress someone else, as long as you're doing it for yourself first, great, but only to impress someone else, say, "This will help me get that relationship," don't do it.
Yes, exactly. Yeah.
Work on your smile. Do your smile homework first.
Exactly. Oh, yeah. Do it for yourself.
Oh, good. Look at that. Woo. You never say those things. You look at people like, "That's right. You know it."
Yeah.
Confidence.
Yes, confidence. And if you do decide to get some surgery, well, check out Dr. Rich. He's awesome. He's in Tampa, Florida. And find somebody really good. It is worth the money. Don't go to the cheapest plastic surgeon you can find, because they'll look cheap. It'll show. The trick is to find somebody who's
most expensive, because you have to keep replacing it.
Yes, exactly. And another cool thing I want to say about you, Rich, is this guy does live Facebook and live Periscope broadcasting of facial surgery, and I eat the stuff up. I love it. I don't know any other doctor that does that, and I think that is so cool, Rich, because you're taking away all the myths and fears, and your patients love it. It's awesome you're doing that.
NPR was in our office last week. They're supposed to be putting out a report this week for the local NPR. So we're really excited about that.
That's cool. Well, I'm going to keep in touch with you and find out more. Rich, where can people find you?
So you can look us up at imagelift.com. If you're on Snapchat, Real Smile DR. We're Instagram and Snapchat, Real Smile DR, Real Smile Doctor. And Periscope and Twitter, at Rich Castellano. We're out on the web. Just type in my name, Rich Castellano. Check out our books on Amazon, guaranteed to make you smile more. If you are interested in cosmetic procedures, this is a good book for that. We are very proud. Both books hit the Wall Street Journal bestseller list. And thank you so much, Esmée, for having me on. And we got to do this again. This was a lot of fun.
I loved it. Thank you, Rich. I'm going to get this to you, and we'll put it on YouTube, okay?
Perfect. I love it. Thank you, Esmée.
Bye.
You're
Thank
helping
you.
people to smile. I'm curious about their smile scores. They can bump up, and the higher their smile scores, the more dates and first and second and beyond dates that they're going to get.
I will let you know. It's a
All right.
great formula. Thank you for that. Ciao.
Big hug. Bye.
Same to you. Bye, sweetie.